what the next session is about. So as we were saying before, today is the Inspiration Day, and we really want to get us all together and, well, assemble some inspirational stories from all of you. I think we really need a little bit of inspiration today, nowadays, actually, because we've all had a very tough year with the COVID pandemic. As you know, a lot of programs, a lot of activities had to be canceled. There were a lot of consequences, of course, in programs, in all of our work. But on the bright side, what we at least saw happening a lot over the past year was so many inspiring stories by so many inspiring young people. And it made us realize how resilient we as young people are and how super powerful we are. I think it's a great idea to share some of these super inspiring stories with each other. And of course, if you feel comfortable, please feel free to also share what you did, for example, to be extra resilient during the COVID pandemic. So that's what this session is about. Again, can we all give a bit of a thumbs up or put your cameras on to let us know that you're back and that we're ready to invite our next speaker, which is, yes, it's very good to see you are here. Welcome back. So then we have someone very special here, which is Nuwamanya Hillary, a youth advocate from Uganda. I don't see him yet here, at least with his camera on. There you are. Welcome. Good to see you. I can't hear you that well yet.
Yes, it's good to see you too.
You're breaking up a bit, Nuwamanya.
I think so, but am I clear now?
A little bit better? Not really. You're really breaking up.
Maybe you need the videos.
You don't have your camera on, but I think it indeed helps if you maybe leave your camera off, even though we'd like to see you, but if it really helps for the sound, then it might be better.
Yes, my camera is off.
Can you say something, Nuwamanya, so we can know what your connection is?
Hello.
Okay, we can hear you a little bit better. I also hear my own echo. Okay, so if you, in the meantime, can try to restore your connection a bit, then let me introduce you again. And I think there's also a PowerPoint that we can share. So for the ones that weren't back in the session already, what we want to do on this first day on Shawishi Planet, the Inspiration Planet, is share inspirational stories from all of us young people who are super resilient during this COVID pandemic. And I think we can all use some inspiration to start our week freshly with. And the first one who's going to share his story with us is Nuwamanya Hillary from Uganda. Are you still with us, Nuwamanya?
Yes, please, I'm still with you.
Now we can hear you super clear. So I'll give the floor to you.
Thank you so much. hello everyone, my name is Nuamanya Hilary. I'm studying with the Czech from Uganda, and I'm an organization called Uganda in Iba, and I'm I'm a advisory committee based on the Alliance Uganda, and I'm a webcast in 2019. Also
Okay.
sitting.
Nuamanya, I'm sorry to interrupt you. You're breaking up a lot. We really cannot hear you. You're you're breaking up a lot. And I see also people saying in the chat that it's not me. Can you maybe try some other way to restore your connection? And then maybe in the meantime, as I know we're with a lot of young people, youth advocates here in the room, I was wondering if maybe in the meantime, while Nuamanya is trying to restore his connection, if there's someone who can share an inspirational story with us, maybe about what your organization or what you personally did to overcome the challenges during the COVID pandemic. I know a lot of things happened because I already know a lot of inspirational stories from different organizations. But as we're here to inspire each other, I'd like to hear from you. So don't be shy. For example, someone from Taya or Siese. I know you're doing a lot of interesting activities.
Let me think of something first.
Go ahead, Priska.
No, I'm saying I should think of something and then I'll be back.
That's also good. I see Manal wants to say something.
Yes, hello. Can you hear me?
Yes, we can hear you loud and clear.
Yeah, I can share just a small detail about the pandemic, the the COVID-19, not 20. Well, during the COVID, I worked with some of my friends. I used to be a student back then. So I worked with some of my friends on how can we put in order CSE with the pandemic, especially that without the pandemic, it was like really hard to work on this topic. So how can we just work on this topic during the pandemic? And especially when it comes to students, like students from 10 to 18 years old. And it was really useful for us because we worked from home and the results were very fruitful and it was very insightful. We could reach many students because we reached like schools, and we just coordinated with them to just put in order the CSE in schools online. So it was a very good period for me, for my personal experience.
That sounds very interesting indeed, Manal. Thank you so much for sharing. And I see indeed several people applauding you. Is there anyone else who wants to share something with us?
Maybe I can share.
Go ahead.
I can also share something interesting. Sorry, that was the fan.
Go ahead,
I think
Priska.
during the COVID-19 pandemic, we saw a lot of issues happening. Schools were closed, access to services was difficult. And I think even for staff, it was also something that was also overwhelming on us, not being able to interact, sometimes working from home. So it was a whole different dynamic for everybody. So I think it was a moment that we realized that mental health issues are something that need to be discussed. So I think what we've seen now is now we're integrating more mental health issues into all the programs that we're implementing, ensuring that checking on people, are you actually okay? If you're not okay, you can at least take a day off, recollect yourself. But also when we go to the communities, it's also overwhelming to see that the safe space for some girls is actually when they go to school. When they go back home, it's usually they either go through GBV or SGBV. So we just made sure that we created those safe spaces in the communities, whether it's the girls' clubs, just giving them chances to speak out in every chance that they get, and also bring up issues of mental health so that they can understand that it's okay to speak out if you're going through something. It's okay to confide in someone, but also it's okay if you don't want to talk about it immediately. So we've also been linking them to the different counselors that we have at community level, but even here at the office, we've been sharing some of the scenarios that so that we can understand in depth what mental health is. I think we're all going through something, and it's good to actually find someone that you can talk to. So I think this year and last year has made us realize that we need to take care of each other, but also we need to take care of ourselves. So I can share that for now.
Yes, indeed. Thank you, Priska. That's indeed very inspiring. And I so much agree with you. I think that's one of the, well, if I can say it like that, one of the bright sides actually of the COVID pandemic, that we all really became aware of our mental health status, and that's, you know, it overcomes everyone that you have an off day or that you feel really bad. And I think I at least always feel very strengthened by the people around me, and that, and knowing that it's okay to feel like that, and that we can all support each other, and that we're all together in this. Yeah, I hope it's also something that we really pursue in the coming years, and that we keep being this, well, this community really of young people all supporting each other. So thank you so much for sharing. I see that both Lily and Sraya, if I pronounce your name correct, from UA have their hands up. Did you want to share anything? Yes, Lily, go ahead.
Yes. Hi, everyone. This is Lily from Talent Youth Association Ethiopia. I represent the Right Here, Right Now 2 program. So the story that I want to share with you all is, before the COVID-19 pandemic, we actually had a lot of advocacy work with the Ministry of Health, and we started, to organize the National Adolescent and Youth Health Forum, to bring the young people from all over the country together and to discuss their SRHR issues as well as other health issues. So when the pandemic happened and, we had to shut down our offices, and, face-to-face communication was completely forbidden. So we had to shift the whole forum to a digital platform. And then for a country that doesn't have a lot of experience, in the digital work, in Zoom and other platforms, it was a bit difficult. But what we did was we brought a lot of young people from the country who are very energetic and who are dedicated enough, to get used to the different platforms. And we took over the whole forum, and we tried.
Nous avons réorganisé le forum et avons réuni 1000 personnes jeunes
the different ministers, like the Minister of Health, Minister of the Women and Children and Youth, and I think Minister of Education, to the platform to speak on behalf of the youth. And we got the chance to meet the president as well, and we actually we came up with the youth engagement guideline in collaboration with different ministries as well as other partners, and it was officially launched in the event. And the event was so creative, and it was actually youth friendly, and we were recognized as young people by the ministry, and it was very fascinating. And because of that, after this forum happened in August 2020, and then we made it an annual program. And we did it this year as well in September 2021. And it was an amazing event. It was even better than last year, because now we are used to the digital world. So I think that's something I want to share with you as an organization. Thank you very much. Back to you, Ruth.
Thank you so much for sharing, Lily. That sounds super cool, actually. And like you said, that's also one of the ups. It feels a bit weird to say upsides of the pandemic, right? But maybe I can say like things that we learned from the pandemic. That sometimes indeed you even get closer to other people when it's online, because you have the opportunity to invite so much more people. And it's really cool that you got to meet the president, and also that the president made time for these young people. That should be inspiring for all the presidents all over the world, actually. Schreya from UA, I'm curious to hear your story.
Hi, hi everyone, my name is Shreya, and it's not a story that I want to share, but a sort of an intervention that we took forward in light of the pandemic. So when the lockdown happened here in Nepal, all schools were shut, and we completely transformed into an online school modality. And we realized that sexuality education was not prioritized. Only core subjects such as English, mathematics, and science were taught, and other secondary subjects such as social science, health, population and education, and sexuality studies were completely ignored and not prioritized. So because of that, we actually launched a e-course on comprehensive sexuality education based on the ITJC guidebook. And I just wanted to share that platform here. Although some of the topics is based on Nepalese context, but I think it will be very helpful for young people around the globe to learn about CSE. It was our first attempt at digitization of CSE, and we're still learning and growing. So I just wanted to share that here. Thank you. I'll put the link in the chat box if anyone wants to go through it.
Please do. That sounds super interesting. I think we can all use some online CSE inspiration. Oh, you already shared it. That's good to see. Thank you so much for sharing these stories. I always really love to hear them. And to me, they are a true inspiration. In the meantime, I think he's not here. Oh, there you are. Nuamanya, if you are connected again, please let us know via the chat. But we did really want to share your story, so we can show the PowerPoint that you sent us. And my colleague, Juli, who is there on the Pink Planet, will actually share your story with us, if you're okay with that. It's another way of how we all support each other as young people in these digital times. So I'm giving the floor to Juli.
Thanks, Jose. Yes, fantastic. Yeah, absolutely. I'm very sad that you didn't have the chance to hear this firsthand from Nuvamanja, because we actually had a conversation about the session. And when they shared the story with me, I felt very touched. And I just wanted you to experience that. So I'll do my best to do justice to the story. And maybe in the end, if you have questions, we can ask on the chat so that Nuvamanja can maybe answer to you. So yeah, let's start. So Nuvamanja Hillary is actually part of UNIPA, a youth advocacy coordinator representative, if I'm not mistaken. Yeah, and they work for the SRHR Alliance of Uganda. I think UNIPA is the vice president of the SRHR Alliance. I'm not fully sure. Yeah, so what happens is that we can go to the next slide. So basically, with the COVID-19 happening around the world, in Uganda, of course, it was no different. And in March 2020, the first case of COVID-19 was confirmed. This, of course, as in many other countries, led to having a wide lockdown in the country to avoid spreading or to prevent spreading the virus. But they also experienced closure of learning institutes, mandatory social distancing, among others, which of course affects the provision of SRHR services. And it also affects the mental health of people because of the isolation that comes along with all these COVID measurements. Many things came out as an outcome of this situation. So for instance, 2,300 schoolgirls were reported to have conceived, which is actually a very high number. and 128 young girls have been married off in Kasase district in the west region of Uganda. 180 primary 7 pupils got pregnant in the lockdown, and over 1,000 of young people are likely not to rejoin school even after the economy and lockdown is lifted due to teenage pregnancy and early teenage marriage. Yeah, so we can move on to the next one. So what actually happened that's good or inspiring from this situation was that of course, SRHR services were lacking at the time of COVID, and this was not different for ART, which is, thanks Nuva Manja for clarifying, is the Youth Advisory Committee. Fantastic. So, and SRHR services were lacking, and this was not different for ART, which is the antiretroviral treatment, which is the medicine that is used and is very important for people living with HIV. Yeah, so what they did in UNIPA is that they started with a model that could help them ensure a continuous access to ART, this medicine, and support the adherence to this medicine. They also provided SRHR information to social media platforms and mainstream media. They love it for resources, for example, bicycles to help peers reach out to more young people in need. And they mobilized masses to support young people living with HIV with nutritional support for those that were struggling to afford a meal. They finally also love it for representation of young people living with HIV on different COVID-19 district task forces. I think also what is important to highlight here was that Nuva Manja was one of the youth advocates who was part of the spread-headed model to support the administration of the ART medicine. And they actually worked door to door to the people who actually needed the medicine. And then at some point, because of all the love it and resources, they got access to a bicycle that could help them keep on going with these efforts, which is very inspiring. Yeah, we can move on to the next. Yeah, so what happened, they got over 40 bicycles were loved and distributed to young people to extend the services in the community. Young people led by UNIPA also love it for food in partnerships with their district committees and other partners. Over 2,400 young people were supported by the peers to access ART treatment. This promoted good adherence. And over 6 million condoms have been distributed in the communities by UNIPA ambassadors. Young people are represented in 5 districts, COVID-19 task forces, which of course makes it easier for them to make sure that task forces are accounting for their needs. Some of the challenges that they faced on this process was limited access to SRHR services during the lockdown, of course. Poor adherence to of people living with HIV and reduction in the retention of the recipients of care. Increased loss to follow-up clients, new and high HIV infections. For instance, 14,000 young people were reported to have been newly infected, and high teenage pregnancies were reported in Kamuli district, eastern part of Uganda, holding 3,126 teenage pregnancies from the period of August 2020 to January 2022, as per district reports. I'm not sure what the first word means. Continuation of the challenges. Thank you. Yeah, and then finally, increased cases of sexual and gender-based violence and gender-based violence on itself. Increased numbers of unsafe abortion, which is of course very dangerous for women, and increase of mental health issues, which has been the case in many other countries as well. Yeah, and some of the recommendations that they came up after all these efforts were that there is need to provide more spaces for young people to meaningfully participate in decision-making processes, to challenges and influence government programs towards the needs of young people. And as we can see in this very example, having young people to come up with creative ideas of how to address, for instance, the lack of SRHR services is very vital, because young people can be very creative, and they also can think of ways in which their needs can be met in the best way. And the other one is we need to create more effective and integrated youth-friendly corners, both in the community and in public institutions, like health facilities for young people, and freely interact with health services about their needs. And then finally, there should be a revision of policies to protect young people's SRHR choices and demands by the government to enable young people participate in the uptake of the services without any stigma associated. I'm pretty sure there was something around the provision of arts treatment regarding the stigma. I'm not sure if maybe Hilary wants to elaborate a little bit more on this, but I remember that you mentioned something on this when we were having the conversation, and because of the follow-up stigma that comes with like getting into the treatment of the HIV, this is why you decided to actually just reach out to people by going to their homes. And that's how you manage this. So I think this is actually a very, very important success story to share. We thought you would love to hear about this story, and we wanted to make sure that you actually heard from Nuvamanja, but we're very sad that it was not possible. I'm curious to know if Nuvamanja, you have managed to get better internet at the moment, if you are able to pitch in, maybe share a little bit if I didn't portray something properly.
Hello, everyone. I don't know if I'm now clear.
I can hear you.
Can everyone hear me now?
Yes.
Thank you so much, Julie. It has been a great, thanks for supporting. Thanks for the support. Just add on the presentation. As you understood, Uganda was one of the countries that underwent a total lockdown, and that meant banning of transport, both public and private, and more other programs, more so economically. So as people living with HIV, we felt like the president's directives were not human enough, because he didn't prioritize people that were vulnerable in community and society. So we started, as a young person, we came up with ideas of how best we can support our fellow young people with SRHR services, including ART treatment. And to my experience, I first had a trek. I footed for 54 kilometers on my first day because I didn't have a bicycle. And it was due because a young person who was a mother by then, she had just given birth, and the baby was 2 weeks, and the lockdown found her when she had no ARVs. So I had to act immediately. I went to my health facility, and then I got some medicines for her, both for her and the baby, because I explained everything to the health workers, and they really gave me support. So my problem was now transporting the medicine to her. And of course, other young people reached out to me after I had publicized my services on social media. And so I started supporting more. I had to walk from where I stay to the hospital, and from the hospital to more other young people that had asked for ART. And then lastly, I had to go and meet the young person that was a young mother by then. So it encouraged me after reaching there, and I felt like, I've achieved something, I've helped out someone. It gave me more courage to even work more. So I didn't stop. I continued working. Later on, bicycles came after publicizing my work. And till now, we are still doing the same great work of delivering medicine, even if now the lockdown has been lifted. But more young people, since getting ART treatment, at times in Uganda, it is also stigmatizing in Uganda. People living with HIV are stigmatized and discriminated, both by family and the external people in their environment. So most times what they do, if I stay in Kampala, I have to get my medicine from Jinja, and it is quite a distance and it is much transport, it is costly. So if they cannot get their medicine from Jinja, that means we people that gave in support or declared support, we have to go to Jinja and pick the medicine, then bring it to them. But now things are changing. More people have come out to disclose their status. Young people have now embraced their lives of being HIV positive, and we've seen more young people come out to disclose their status, and hope more young people to also be like them, hence reducing on the rate of infection. I hope it does so, because we think it's a measure that can reduce on the number of the infections. If I disclose to my partner, that means chances of getting infected are less. And of course, other STIs and other health-related issues we've mitigated them. And another thing, we also supported young people with food. We lobbied for food through other agencies. And as they've shared in the presentation, that the district task forces declare, like the government told people, told the MPs, the members of parliament, to create the district task forces whereby we have to have people that represent other young people or represent people in different categories so that they can get the aid from the government. So we've so far had more 5 young people on the district task forces that have always lobbied for food, and it has not ended on food, but we've always fronted our issues through the district task forces and through other engagements like meetings, seminars, symposiums, and conferences. We've always had them come out to speak about their needs and wants to the government officials, and we pray, we get hope, and the government acts quickly. Thank you.
Thank you, Nuwamanya, for this story. I'm happy we get to hear you too. Thank you, Juli, for sharing the presentation and for telling Nuwamanya's story. And I'm happy we could also hear you, Nuwamanya. Thank you for sharing. Is there anyone who has a question or maybe recognizes this story and had a similar experience, who wants to share that with us? You can post it in the chat if you have a question, or if you feel comfortable, you can also just speak up and pose your question. I was actually wondering, Nuwamanya, if you could maybe very briefly tell us something about your organization, UNIPA. Do I pronounce it as UNIPA or?
Yes, thank you so much, Rose. UNIPA is a Uganda network of young people living with HIV. It's a youth-led organization, and it has always, part of its aims is to enable an environment of young people living with HIV, or enabling young people living with HIV to have their own, to enjoy the environment, the kind of atmosphere they feel like they should, regardless of their status. They should be stigma-free. They should be treated like more other young people, or they should be treated like normal people. But in Uganda, we've had cases of HIV stigma and discrimination. So it is, we always have a campaign that aims at having young people living with HIV come out and disclose their status freely, and it is called the UNIPA Beauty Pageant. And I once contested and I became the Mr. Y Plus in 2018, 2019. And more other young people have always come. We've mentored more young people to always come out and disclose and to take up spaces and represent more other young people in society, those that feel like they're vulnerable, and encourage more to come out and live a life that they should enjoy. And of course, share the same human rights like others should.
Great, thank you. I actually love that this organization exists, and I think it's super important indeed, like you said, that these people are represented too. So I think you're doing an amazing job. I don't know if I said it before already, but I always love to see that we're with so many people here together that all work for organizations, for young people, fighting for so many different rights, but they're all rights for young people, right? And I think it's very special to be in the room with all of us together. Is there anyone else who would like to share something or has a question for anyone? You can speak up or pose a question or story in the chat. In the meantime, before we can maybe go to a super short break and then to the closing of the day, I know there's someone in this room who can do an energizer. And for that, I hope most of us can turn their cameras on. So if you can please turn your cameras on, if you can, and if you feel comfortable, of course. But for the sake of the energizer, it's important that the camera is on. And then we have Lily here from Taya, who can do an energizer for us. So I'm giving the floor to you.
Thank you, Rose. So we're going to play a very short game. So I want you to look around your room, and I'm going to ask you to bring me something colorful. I'll name the color, and you'll run around and bring me any item of that color. So for example, if I say, bring me something pink, you have to run around and bring me something pink and show it to me. So the first person who comes with the item wins for that round. Is that clear? Any question? Okay, so I'm going to start now. Everybody ready? Yeah. Great. Oh, so bring me something green. Nice. So I think the winner for this round is Manal. She brought, I think, is that a sticky note? Yay. Okay, so bring me something red. Red, red. I think it was, thank you everyone. Carrie that brought her bottle, I guess. Okay, bring me something blue. I saw Jenny, Hasney, and I think Julie. Okay. I'm trying to think. Oh, okay. Bring me something orange. Rakik is showing her t-shirt. And Manal as well. Okay.
I also have one.
You do?
It's
Where?
made, yeah. No, I wanted to say it's not a color, but everyone has to show something to eat. Something you can eat. It's a little bit harder. Hilal. Hilal has a potato.
What happened to the bottom of that potato?
I don't know. It's very suspicious.
It's not something to eat anymore, Hilal. Shreya, what is it what you have? It looks very interesting.
It's a candy that's very famous in Nepal, and it's made out of hog plums, which is native to Nepal only. And it's sweet and sour, and our Nepal's favorite go-to snack.
Okay, well, now we learned something during this Energizer. Okay, I have another one. It's going to be a hard one. Be ready. Get ready. Show me something that lives. I see a lot of plants. I was actually secretly hoping for someone to show me a cat or something. But Rekik, you are being very smart and you're showing yourself, of course. But I love to see so many plants as well. I love that we all care about nature. What are you? Oh, Lily, what are you showing? A spider. And Hasna, are you showing your sibling?
It's my nephew.
Your nephew. Great to see him. And I
Thank
also
you.
love to see Lily's spider.
It's not a spider, actually. It's an ant.
Oh, an ant. Is there anyone else who has something, who knows something that we all need to show? Something original. What do you want to see on screen? Keep it civil.
Something you love?
Something you love. Good one.
Ourselves?
Ourselves, indeed. I see a lot of pictures. The choice colleagues together. What else do we see? Your phone. I also love my phone. Food. Hasna loves food. Hilal loves music. The hot water bottle, Gloria. I love it too, especially during periods. Your car, Priska, do you love your car or your key?
My car.
Your car, of course. What are you showing, Rehab? What is that?
Mon dessin, je l'ai fait ce week-end. J'ai dessiné ça, mais je sais pas si...
I love that. I love that. And Sami, which book were you showing?
Hey, I was just about to type in the chat. It's the book, you can see it very well because of the background. We are still in space. But it's the book Sister Outsider from Audre Lorde. I haven't read it yet, but I think I'm really gonna love it. And I love reading and the values that come forward to this book and Audre Lorde. So yeah.
Great. Well, thank you for the tip. Please also share it in the chat because I know we can always use some book tips. Okay. I am loving this game. Shall we do one last round and then have a quick break before we close the day? Who knows something that we can all show on screen?
Something SRHR related?
Something SRHR related? That's hard. I see a condom. And another condom. A lot of condoms. What is that, Prakya? An LGBTI flag? Sorry, what do you have?
I'm showing love.
Love. I see Sami showing the safe sex is great sex thingy. What are you showing, Shreya? What is that?
It's actually my yearly planner that I use for my work. I didn't have anything else.
Well, if your work is SRHR related, right? So
Yeah.
I think it counts. Okay, love to see all of this. I love to see so many condoms. We're all prepared. Good for you. Menstrual caps. Awesome. Okay, good. Okay. Thank you, Lily, so much for organizing this Energizer. Thank you. I think before we go to the closing session, we can have a quick break, all of us. I hope you enjoyed this session. It was a little bit different than expected, but hey, that's how it goes, huh? Working online and working digitally. And I think we all helped each other out here. And I hope it was a good first inspiring session to also keep inspiring each other for the rest of the week. I think it was a very good start for the rest of the week. So thank you everyone for sharing and for being connected to each other, for the love. Now let's have a quick break. I'm looking at my colleagues. At what time do we start the next session? At 15. So we're back here in 10 minutes. So we can all have a quick 10-minute break, get some tea, get something to eat, a hot water bottle. And then in 10 minutes, we're back here for the closing session. See you soon.